Okay, so I'm going to demonstrate with the guide tube now. So right here, right away, we've got a different situation, you see? Whereas these are in the 10 packs, all right? And they come in different ways. The DBCs come both in the 10 packs and the spring singles. I tend to prefer the singles just for sterilization purposes. I prefer single-use disposable needles in my practice. In the clinic, I think mostly they've got you guys using these. So different people prefer different things. Really just up to you what you feel more comfortable with, okay? I don't think they do have Sarins in the clinic. You know, I'm a spoiled brat. I grew up with Sarins, so that's what I'm using. But I know at least I know Dr. Benko does not allow the guide tube on her clinic shift. So you know it's going to be the preference of which clinical supervisor you have, but I'm going to show you this just because I think it's very valuable, and because some of you may find this works better for your body or style of practice, and that's a very personal thing. So I just want to give you all as many options as possible so you can experiment and find what works best for you. All right, so right away you see we've got a different setup here. We've got the Shinkan, right, the guide tube. Okay, so for this, I still like to steady with my fingers against the skin. The guide tube gives a lot of advantages, okay? I mean, I know a lot of people sort of poo-poo it as kind of cheating, right? But I don't think there is such a thing as cheating when it comes to the safety and the consistency of a needle technique that we're going to be using to help our patients. I think the only thing that should be the arbiter of that is patient outcomes, right? What works better for you, what's going to enable you to give the least painful and the most therapeutic experience to the patient, okay? So no guide tube shaming in my class, okay? All right, so you're gonna find the point, and we have a whole thing on palpation that'll help you figure out where to find the point. Something I didn't show with the freehand techniques, all of these should be done two-handed. Now, what I mean by that is you're palpating, you're locating the point with your offhand, whether that's your left or your right. And once I find the point, I like to keep my finger on it. Here, you can probably see better from this angle. I like to keep my finger on it, and then I'll find it with the tube, and I'll use my guiding hand, my yin hand, my mother hand, whichever you prefer, to assist in stabilizing the needle. And the Sarins have this really nice clean release that I like a lot, where all you're doing, here, let me just show you this so you can see. So you just press like so, you press the needle, that releases it in the tube, and then you can hold it in the guide tube like so, just gently against the side of the guide tube. And then from here, the advantage of the guide tube is that it really gives you excellent stability and consistency and control in where you're pointing that needle, and it going where you're gonna point it in any which way. All right, so as soon as I feel like I've got what I want out of that, I'm gonna release and just tap once or twice, and you're good, okay? And then from here, that's just to get the needle into the skin, okay? So then from here, and you know, you can do whatever you want with the guide tube. There's all kinds of fancy things that you can do with it. I just stick it in my pocket, or I put it in a little tray next to me, whatever works, okay? So from here, now the needle's just in your skin. You've only done sifa, you've only done insertion method, insertion without getting dirty. Sorry, you can only see the bottom of my face, but that's not really where the action is for us anyway. So now you can hunt for your dirty, right? You can hunt for the actual, the bite on the needle that we talked about earlier, okay? And when I'm doing this, notice I still use my freehand needle technique, right? I still use my freehand mechanics. So I'm posting with these fingers, and I'm using that to guide the direction of the needle, okay? And to steady it, right? So I can come any angle this way, and I can do my twirling exactly the same, you see? I can do blue-green turtle hides its head in the sand, or whatever you want to call it. There's a million names for all of these techniques because our medicine is a history of crotchety old men arguing with each other over millennia. And notice I'm still palpating here, okay? So I'm still feeling for changes in the tissue, all right? And when I've got what I want, when I feel like I've gotten the feel that I'm looking for, that's when I leave it, okay? And you let that cook for however long your treatment indicates, all right?